Meanwhile, gun violence is officially a public health crisis in America. That's according to the U.S. Surgeon General today. Learning how to reduce gun violence was the goal of a conference that was hosted by the UB Jacobs School of Medicine. Our Dylan Morello joins us here live in studio with the details. Dylan?
Yeah, that's right, Rob. Mass shootings are a weekly, sometimes daily problem across the United States, with people losing their lives to gun violence every day in this country. Now, local medical universities are calling for doctors and future health care providers to promote gun safety education during regular visits.
The victims of gun violence and their family are a significant portion of this crisis, but also it is about the people who take care of the patients and their families.
On Saturday, healthcare professionals, students, educators, and the community gathered for what's called the Remembrance Conference, taking a public health approach to gun violence.
It turns out that talking to your physician is a really important part of public health. We can encourage people successfully to quit smoking, and we can encourage people to make sure their guns are safe in the house.
Launched by Dr. Allison Brashear of UB and Dr. Aaron Susha of Michigan State University, the annual event was created in response to mass shootings that impacted both campuses in recent years, at the Tops supermarket in Buffalo and on the MSU campus in East Lansing.
We're really focused on educating physicians to do a great job for the person in front of them and also for the whole community. And that shared passion and interest in making communities better and partnering with communities just turns out to be a great way for us to work together.
In its third year, the conference covered topics including mental health, suicide prevention, advocacy training, and the physician's role in addressing firearm violence, providing a platform for more prevention and awareness.
You can work on laws and public policy, but you can also work on how doctors and the whole healthcare team interact, both after there's been a crisis but before.
Brashear says gun violence is now the leading cause of death among teens and young children. For Rob Gore, an emergency medicine physician in Brooklyn, New York, UB grad, and author of Treating Violence, an emergency room doctor takes on deadly American epidemic. This isn't about turning every doctor into a psychiatrist.
Part of that work in practicing medicine is not just treating a patient's physical injuries or understanding their psychosocial injuries, but coming up with ways to make sure that they don't have to become patients. Our job as physicians is to become teachers and educators, but really to kind of become obsolete. If we're focusing purely on treatment modalities that don't have anything to do with prevention, then we're not making our patients well.
Now, organizers emphasize the broader scope of the crisis, noting that mass shootings represent only about 1% of gun-related incidents in the U.S., while domestic violence, accidental shootings, suicides, and firearms not properly secured all far outstrip mass shootings. In the studio, Dylan Morello, News 4.